1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU
Recording
has
in
pioneered
progress.
in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
A united community.
We may not be blood related,
but we Patriots are one big family.
Being part of the PWU community strengthens us.
Through the years, we support each other through good times and bad times.
We Patriots always have each other's back.
It's a big honor to be part of a community that is open to the ideas of each other.
drives us to excel and be the best version of ourselves.
That's the standard of excellence that we Patriots strive for.
I'm thankful that this community lets us be who we want to be.
We thrive because we accept each other for who we are.
And like a family, we treat each other equally.
Actually, PWU gave us a home and helped us to be a patriot in society.
We may have different individual drums and instruments,
but we march to the same beat together as one united community.
Do you want to march with our community of patriots?
I am a patriot.
I am a patriot.
I am a patriot.
I am a patriot.
Good afternoon, ladies and gentlemen. We hope everyone is having a blast today. My name is Pauline Ann Rodriguez, and here is my partner, Shireen K. Encarnacion. We are from PWU Graduate School of Nursing, and we are your host for today's webinar.
Yes, good afternoon, everyone, and good morning or good evening to our participants, wherever you are in the world. We would like to welcome and also thank you for being with us in this event.
You know, Shireen, we have been hearing a lot in the news about COVID-19 pandemic and how it has been affecting a lot of us, be it in our profession, relationship, and most especially in education. But this pandemic will not stop us from continuously learning, right?
You are right, Miss Anne. Thus, this afternoon, the PWU Graduate School of Nursing initiated a very interesting and exciting topic to start off our learnings for 2022. With this webinar entitled Catching Up with Nursing Trends and Issues, Latest Updates in Nursing for 2022 and Caring for Carers.
Moving on, Ms. Shireen, I'm sure that all of us here are already thrilled as we are to learn from our esteemed speakers.
Surely, Ma'am Anne. But before that, let us first enlighten our participants of the objectives of this webinar.
Yes, what are expected when we finish this webinar? First, our participants will be able to complete a webinar under the subject Current Issues and Trends in Nursing and apply the learning in their field of specialization.
Furthermore, our participants will become familiarized with the latest updates in nursing for 2022 and methods on how to care for carers amidst this pandemic season.
And as part of the university's objective, which is to develop and build the student's character, may I present Ms. Maria Cristina Ria Ribolio to officially begin the program with a prayer, to be followed by the singing of our national anthem.
Let us bow down our head and feel God's presence. Almighty and loving God, Creator of heaven and earth, we glorify and thank you, God. We humbly ask your guidance in this virtual learning with an inspiration and self-reflection. We also pray for our speakers and facilitators in sharing knowledge with their earnest efforts and compassion. We praise you, God, all the days of our lives. Amen.
di mo'y buhay. Lupang hinirang, duyat ka ng magiting, sa manlulupig, di ka pasisiin, sa dagat at bundok, sa simoy at sa langit mong bukaw, may dilagang tulad, awit sa paglayang minamahal, ang kisap ng watawat mo'y tagumpay na nagdiligdig, ang bituin at araw niya kailan pa may di magdidinig, lupa ng araw ng walpatit magsintabay langit sa piling mo, aming ligaya dapat may mga abi ang mamatay ng dahil sa'yo.
Thank you very much, Ma'am Christina. Of course, as always, all the things we do is for the greater glory of God. Again, as the chairperson, on behalf of everybody behind the scenes of this webinar, I welcome all of you. We are going live here in the Kingdom of Saudi Arabia. Marhaba and assalamu alaikum.
For our Chinese friends, ni hao, I hope I said it correctly. And to all of you back home in the Philippines, mabuhay. We are being viewed live via the Philippine Women's University official Facebook page and YouTube channel. And with that said, please hit the like and subscribe buttons to be updated with more educational videos and webinars like this.
And also, Ma'am Shireen, they can also consider sharing this video. And as they say, the more the merrier, right? So that more people will be informed and educated with us today. And we would like to acknowledge the presence of our honorable program chairs and deans in this meeting room and invited guests. Thank you very much for joining us.
So, Ma'am Anne, I think we are already talking too much and taking the spotlight from the event.
Yes, and for our dear participants, with your attendance, you will be receiving a certificate after you have filled up the evaluation form, which will be flashed before we will end.
With all this said, we will now be beginning today's webinar with the theme, Catching Up with Nursing Issues and Trends, Latest Updates in Nursing for 2022 and Caring for Carers.
Yes, I think we have already briefed them enough, Ma'am Shireen, and at this point, I would like to introduce to you Ms. Bian Solito Manay to give her opening remarks.
Hello, everyone. Good afternoon, Philippines. Good morning, Saudi Arabia. On behalf of the Philippine Women's University Graduate School, Master of Art in Nursing, I am honored to welcome you to our live webinar entitled Catching Up with Nursing Trends and Issues, Latest Updates in Nursing for 2022 and Caring for Carers. I would like to acknowledge Our Excellency, PWU President, Mr. Marco Alfredo M. Benitez, to the Vice President of Academic Affairs, Dr. Felina Young, to our distinguished guest speakers, Dr. Lucila Ortiz Espinosa and Mrs. Janalyn Ganal Abala, to our dear School of Nursing Dean, Dr. Minerva B. De Ala, to the respectable PWU Deans from Allied Health Schools, to our dear nursing professors, most especially to our very supportive professor, Dr. Mark Santos, all guests from different institutions, fellow students, ladies and gentlemen, it is with great honor to welcome you all to this webinar. Indeed, today is an amazing day. As nursing is a vocation, we are meant to care for our patients with respect, kindness, and compassion. However, as human beings, nurses deserve compassion and nurturing as well. Dr. Ortiz Espinosa will be enlightening us on how important stress management and self-care are for nurses, especially during this time when healthcare workers are facing their toughest challenge. While Mrs. Ganal Abala will be sharing with us the current job trends for nurses in 2022. With that said, be ready to learn and be inspired by our eminent speakers. You are welcome to take notes because both of our speakers are truly formidable in their fields. Once again, good afternoon and thank you.
Thank you for the warm welcome and opening remarks, Miss Pian. All right, I hope everyone is watching and joining us here in Zoom and live stream in our official PWU Facebook page. I hope everyone is wide awake since we all know that during this time it's siesta, right? While some of the people in Riyadh, KSA are just about to start their day. So what's next, Ma'am Shireen?
With all the excitement to deliver current trends and issues in nursing for year 2022, allow us to just give a few gentle reminders to keep us all settled in. Please be reminded that if you have questions or concerns about our topic, we will entertain your questions for the Q&A right after the lecture during the open forum session.
With that having said, we encourage you to submit your text questions via the comment section of our live stream in the official PWU Facebook page. You may send in your questions during or right after the presentation, and we will collate those and address them during the Q&A session at the latter part of the lecture. And now to get started with our main event, allow my colleague Ms. J. Sirens Basero Makuha to introduce our first guest speaker.
Good day, everyone. It is my honor to introduce our first speaker for this webinar. Our speaker is a proud graduate of Bachelor of Science in Nursing from Dr. Carlos S. Lanting College in Novaliches City. She had her Master of Arts in Nursing in Manila Central University and is currently pursuing her doctoral degree in nursing in her very own Philippine Women's University. Our speaker has more than 20 years of combined teaching and clinical experiences in universities and hospitals here and abroad. She used to be a staff nurse and faculty in her college alma mater, Dr. Carlos S. Lanting College in Casal General Hospital. She has also been a clinical instructor in Universidad de Manila, Far Eastern University, Al-Jabal Al-Garbi University, and CERT University, the latter two located in Libya. Currently, she is working as a nursing faculty, lecturer, and clinical instructor in PWU. Today, our speaker will share her vast insights and experiences in the ever-changing healthcare trends. Ladies and gentlemen, please join me in welcoming Ms. Jeneline Ganal Abala, RN, MAN.
Good afternoon to our beautiful and bright Dean, Dr. Minerva Diala, to one of the pillars of mental health in the Philippines, Dr. Lucila Espinosa, to one of our intelligent professor in PWU, Dr. Mark Santos, faculties of nursing, nursing student, ladies and gentlemen, good afternoon. Thank you for that wonderful introduction and kind and generous words. I would like to take this chance to thank Gilda for believing in me and for the chance of being your speaker today. On the other hand, my apology that I don't speak English fluently, but I will try to express myself for the sake of participants, international participants that are here with us today. So to start with, I would like to share my slide. Okay, so our topic for today is about the latest update in nursing for 2022 and caring for carers. And disclosure, I do not have anything to disclose. And the learning objective, I divided into three, which is the knowledge, skills, and attitude. For the knowledge learning objective, to understand that the current field of nursing become more educated, to know the different kinds of opportunity to take on expanded role of nurses and fill the need of our patient in the years to come. For our skill learning objective, to be able to consider earning an online nursing degree education to a globally competitive nursing school or university. To be able to make use of nursing informatics in the new telehealth care system in caring of our patient. And for our attitude learning objective, to be able to show that the healthcare provider and patients alike how well the system of telehealth can work. And lastly, to be able to value the patient's comfort and convenience using the telehealth technology to reach the patient's healthcare needs. So those are the learning objective, while this one is our outline. This is the outline of what we are to discuss. So in year 2022, there are new doors opening for all the nurses this year, wherein there are actually too many, but I just decided to just summarize it into 10, wherein these 10 are interrelated with each other. And to start with, their doors are open for the online nursing program. And of course, if there is an online, there will be a much more higher education for each one of us. The door is also open for increase in specialization in our own field. And there will be nursing informatics development or progression of this technology. And if there is nursing informatics, of course, there will be telehealth, telenursing, and telemedicine. And so as well, there will be in demand for traveling nurse and bilingual nurses. So if that's so, there will be more job opportunity, and as the opportunity for job increases, there will also be a shortage in nursing in 2020. And as we have the shortage, the employers will continue to value their nurses and will be more generous on the salaries and benefits. And so as well, not but not the least, we have the mental health for nurses. So this is the outline of the topics that we are going to discuss today. But to start with, let me share with you the milestone of my nursing career as a start, and then I will tell you later uh, what is the connection of my milestone to the current trends right now. To start with, I would like to share with you that after graduating from college with the Best in Clinical award and passing the board exam, finding a job was been very difficult for me and for my batchmate. That was year 1990 or early 90s. And I know that some of you could relate to my story because that time, the hospitals were looking for a 2 years experience as an initial requirements for their applicant. So my question that time was, how can I have a 2 years experience wherein I just newly graduated from college and no one offers or give us a first time experience? So that was a dilemma that time, wherein I thought that the nursing, my dream of becoming a nurse will shatter and would be impossible. But there was a trend that time, which is a different kind of trend, wherein you're going to apply for a job but you're going to pay the employer to hire you in exchange of your experience and a certificate that you have worked with them. So it's a little kind of funny and it's like a joke, but that is true. You're going to pay the employer to hire you. So in order for me to have an experience, I grab this chance because I don't have a choice, but I have to start with my nursing career. So in short, I pay the employer. I know really some of you could relate to this trend that time, wherein where in the world can you find such arrangement? You're going to pay the employer to hire you. So it was not been too long wherein I was being promoted to become a staff nurse and I earned 7,000 pesos as my initial salary. And that 7,000 pesos they called a salary is but just like a what you call this? It's just like a allowance to me. It is a salary that it won't reach the next salary or the next payday. And then my dean saw me in that hospital and told me, Jenny, enrolled into nursing school and I will take you in even if you're not yet finished or just taking 9 units subject, I will take you in. And that's what I did. And then from the salary of 350 pesos per day, my salary increases from 350 pesos to 450 pesos per hour. So can you just imagine the transition of my salary from just being graduate of a BSN to having a master's degree? So compute the 300 pesos times multiplied by 8 hours a day. So that was my salary after I took up my master's degree. Then after that, more opportunity came wherein I was able to work abroad, particularly in North Africa, in Libya, for 8 long years. So just to show you my hometown in Libya, this is also the hometown of Gaddafi. So the life there is so simple, quiet, and very peaceful. But ill-fated came wherein there was an unrest. There was a civil war in their country that time. During the civil war, I chooses to stay there before the war, during the war, and after the war. It's not just of being a brave, but it's a different kind of intentions that the reason why I stayed in Libya. So this is our situation before the war, and this was during the war, and this time the Philippine government is already asking us to repatriate, but I chooses to stay and transfer to a much safer place. And then when we come back after the Civil War, this is our hometown after it. So after the Civil War, there was no president, there was no law, and then the ISIS took chance of this situation and tried to took over the country. So ISIS came, and the situation in Libya get worse and became more dangerous, and it is not livable already. But still, even if that situation is that so, our salary is still continue to be sent in our account. So while in Libya, while the ISIS are taking over, they took over 21 Christian Egyptian and they beheaded them because they were Christian in the Mediterranean Sea. So they captured 21 people from Egypt, and then they also captured 8 nurses, 8 Filipino Christian nurses but they were not harmed. Instead, they helped the ISIS in taking care of their wounded allies, and according to these nurses, they were treated right and with respect because they were nurses. By the way, they were all my friends. So the situation get worse and my family back in the Philippines get worried, especially my mom and my daughter Jeremiah. And my daughter were asking me that time, Mommy, enough for Libya, please come home. You already have a house, you already have a car, and you already have a small business. What else can you ask for? It's dangerous. And then she asked me, how much are you earning anyway, Mommy? And then I got the calculator, show her the figure of my salary. And then with her eyes wide open, she told me, Mommy, I want to go to Libya and work there with you. So it's funny. It seems that the figure of my salary is inviting because it's a 6 digit, and the Libya government continued to send our salary even if they are in civil war. After the war, the Libyan government sent our salary to Philippines, and I was able to build a room for rent for my parents and a small rice building for my daughters. So that was the compensation that I get from this situation. So what am I trying to tell everyone here is that wherever you go, in whatever circumstances you may be, nurses will always be needed, nurses will always be well compensated, and nurses will always be respected, and the opportunity for job is anywhere and elsewhere. You could get it in whatever situation. So that is a connection of my story to the new trends right now. So again, this and again, the nursing has ranked the most ethical and honest profession for 19 years in the row, and the healthcare workers are one of the most in-demand jobs in the globe, all over the globe. So this seminar will let you understand the growing role of nurses in healthcare, and to let you know that there was already a dramatic changes happening in the healthcare before the pandemic. It's just that the COVID-19 makes these changes very quickly because we need the changes in the healthcare very quickly this time of pandemic. As the science advances, the nursing shortage continue, opportunity for nurses will find meaningful, well-paying work continue to grow. So in short, I will identify with you the 10 nursing trends to look at this 2022. So the first nursing trend is actually the online nursing program will continue to be popular. So as well, if there is a online, this is in connection with the virtual simulation, will also increase in popularity. Now, what are the benefits of this online education? We will enjoy the flexibility of this program. For instance, I know that everybody of you could relate to what we're about to say, wherein you are working and at the same time enrolled in a nursing class or PhD or master class. You are hitting two birds in one bullet, and then you are also enjoying the flexibility of your time while gaining an additional higher education. And online education also has opened to rural areas. This is actually unimaginable wherein there will be a university in rural areas. But because of this online program, there were universities in rural area just only by the use of Wi-Fi and their gadget. So there will be more further education, create new opportunities, and advance career. And so as well, the virtual simulation, this program is designed to help standard practice of nursing skills like clinical decision making virtually. So this first trend help increase the best care possible. So of course, if there is an online education, there will also be a higher education and training increases in demand. Like for instance, there is an increased number of nurses, Bachelor of Nursing. Now we are still continue to rise. The enrollees continue to rise in every university. Same as well with the master's degree, PhD, and DNP. So DNP means Doctor in Nursing Practice. There will be more trainings and more job prospects, high salaries, and better patient outcome. So these are the qualifications for the role like nurses manager, nurse educator, and clinical researcher. So as there is a continue on higher education, this is a help increase the best care possible. So there will also be increase in specialization and career path option, wherein there will be a 96 areas you could choose from depending on what you want and your passion in nursing. You could be a ICU nurse, a pediatric nurse, or dialysis nurse, or if you want, you could be a case manager, nurse educator, or nursing manager because you will be specializing in whatever you like. So, of course, if you specialize in one field, there is a much higher demand for you to be hired more compared to those who didn't specialize. So, in short, to summarize, career path option will become endless for the nurses. So again, this specialization will help increase best care possible. So if there is a specialization, there is also a nursing informatics specialization wherein it will be growing specialty. There is a need for the nurses to be a technology savvy and increase mobility in equipment. So nursing informatics will need to have a new technology, uses computer. It also improves patient care, reduce administration time, increase inaccuracy, and it also obtain patient information. Actually, nursing informatics is already included in our curriculum. It's just that it needed to be more implemented and more laboratory or more computer laboratory for the nurses so that we will really enhance this subject in our curriculum so that when they graduate from nursing, they are already informed and know what to do with the nursing informatics and in the advancing technology in the nursing profession. So there is also what we call the use of laptop card, the mobile technology. So this is the picture of it. It is a literal that the laptop is in the cart, but the cart has all the equipment that you need in caring your patient, treating your patient, and there's no need for you to use or bring with you your chart because everything is in the laptop already or the data of the patient, wherein you could print it if you want a copy of it, as many as you can, and you could also input all the new details about the patient. So it is a literal that the laptop is in the cart. And this is also wherein there is no more manual charting because the charting is also goes in checklist. So there's no need for you to think and thoroughly observe your patient because the list is all in laptop. So that is the new trend of nursing abroad. And I hope sooner it will be the same in the Philippines. So if there is nursing informatics, as I said, that these trends are all interrelated with each other, there will also be a rise in telehealth, telenursing, and telemedicine. So this is the old kind of telehealth wherein all the equipment are available, the stethoscope is there, and then you will be just talking to your doctor through webinar. But there is a one that is going right now that is more improved than this. I will show you later. So this is the system or the process of this telehealth, wherein the doctors will get all the information and it all listed in the laptop. And here is the patient wearing blue, wherein the doctor will not have difficulty of retrieving all the data about the patient because everything is there. For instance, number one, all the patient data. Number two, the past surgical history. Number three, probably the gynecological history. Number four, all the laboratory workout, and so on and so forth. So there is no need for the doctor to ask the patient about the medical history because everything is there. It's just that he need to input the latest condition of the patient. So everything will be in private and confidential. So um, there are reports that the telemedicine revenue will triple in 2023. It's because this will save the traveling time of your patient, save the time of waiting, and the patient will be in the comfort of their home. So in traditional consultation, the patient will travel and still wait until the first patient get out of the doctor's room after treatment. So that is just the traditional scenario. But this time, you will also enjoy the safe of being exposed to the other diseases. This technology will also expand the healthcare horizon and it will be very flexible. So in this telehealth, the patient will also know and learn more about diseases and be more educated not only on the diseases but in the new technology and new trends right now. So if your baby boomers relatives are not yet holding any gadget, start teaching them so that they would be literate in using the nursing informatics in the near future. So again, this trend help increase the best care possible. But there are concerns in the telemedicine. So these are the concerns because they have interviewed patient ages 50 to 80 last June 2020, wherein 75% of these patients provides not able to conduct a physical examination. So nurses, you know what is the importance and how important the physical examination to the patient. So it is a higher percentage, that is 75%, that they are not satisfied or they are not being checked thoroughly doing the physical examination. And another thing, 67% quality of care is not as good as telehealth visit compared to the face-to-face visit. So it's still in higher percentage. And so as well, 45% are not feeling personally connected to their doctors or to their healthcare providers. So this 45% has also something to do with this 25% wherein having a difficulty of seeing and hearing the healthcare providers. So again, it is also have relationship with this 24% wherein there is a privacy concern. As we all know, um, Filipino are having this very close family ties wherein in one house there are at least two or more sharing the house altogether, wherein each family is not having their own privacy anymore. So this is why probably there is a problem with seeing, hearing, and feeling not personally connected to your uh, to your patient and to the doctor. So I hope that in the near future, we're going to resolve this percentage to do something about it in order to give the best nursing care for our client. Now, on the other hand, there is an increase of visit of telehealth from 4% in 2019, it increases to 26% in 2020, and it was been projected that by the year 2023, this figure percentage will triple the people who will engage and will use this telehealth visit. However, I have here a short video. Please spare me with me. This is only a 2 minutes video, and I would like you to thoroughly examine the kinds of examination they do and have your reflection after after the seminar. So spare me these 2 minutes and please watch it. Okay. So I hope my connection will
is
not
an innovative French company founded in 2008 by Dr.
will
Frank
not
Bourdieu.
leave it.
H4D strives to provide concrete solutions to major issues in the provision of health services, notably to break isolation from healthcare, whether geographical or social. The cornerstone of H4D solutions is the Consult Station eHealth booth. This patented and certified medical device is used to monitor the health of patients and individuals, including the elderly, and prevention of chronic diseases. It allows access to healthcare where medical resources are sparse and in isolated areas. In healthcare institutions, the Consult Station supports medical and paramedical personnel by ensuring systematic and consistent measurements of physiological parameters. The Consult Station allows for more thorough examinations through connected medical instruments such as a dermatoscope, using a fiber optic camera for the skin, an otoscope for ear, nose, and throat, an electrocardiogram for the heart, a stethoscope for heart and lung sounds. The use of disposable utensils and cleaning protocols ensure perfect hygiene between sessions. Reliable and quality measurements are ensured by certified sensors, the control of environmental conditions, and ergonomics of design. The Consult Station is a true medical center operated by a medical doctor. The doctor can carry out a consultation remotely as he or she is used to, communicating with the patient through video conferencing. Confidential medical records are stored in certified and secure data centers, meeting health and administrative requirements in compliance with current regulations. Medical protocols developed by H4D are consistent with best practices and international recommendations. They allow the monitoring of multiple chronic diseases, particularly heart failure, hypertension, melanoma, and obesity. Health programs developed by H4D are supported by the use of leading technology. They allow for a more fluid flow of information, thus optimizing access to healthcare.
All right. Thank you for bearing with me. Thank you for watching the 2 minutes video. So actually, this is already what they call the true medical center in the near future, and this will also resolve somehow the shortage of our healthcare workers. So this is a consultation center wherein it monitors the patient condition, wherein all the basic vital signs are there, even the improvised ECG. It's just that you need to instruct the patient on what to do inside the cubicle. So there is also a camera for the skin. If you want to have a closer look at the skin, there is a camera. There is also a stethoscope so that the doctor would listen to their heart and heart sounds and lung sounds. And then they're using this and taking care of the patient through a video conferencing. It's just that you need to develop another skill in using this cubicle, wherein you have to have a thorough observation whether the patients need a doctor to come to her to visit her personally, and or let the patient go to the hospital. So you have to do this assessment virtually. So this is also additional skills. So if there are telenursing, then there will also be a demand for traveling nurse. And we also need a bilingual nurses will also increase. Okay. So in demand for the traveling nurse, there are thousands of nurses poured into COVID hotspots. So do you still remember during the peak of COVID, wherein the nurses were even deployed to different parts of the Philippines to care for the patient, the COVID patient, to do the swabbing and going elsewhere. So the last few years show us how much our society needs traveling nurses to meet shifting demand to support the volumes of the patient. So nurses become travel friendly, wherein you could travel around the world. And where in the world can you find such a profession wherein you are already enjoying the travel? Of course, the airfare are being paid by your employer, sometimes with hotel accommodation, free board and lodging. You're enjoying the trip, you're helping the people, and most of it all, you are earning and you are having your salary while you are enjoying. So this is only in the nursing profession. Like for instance, if you go to some other places, because you're having a medical mission, so those are just examples of traveling nurse. But I'm not limiting this traveling profession only to nurses, but there are also professions that are traveling, but not as much as they needed, as many as nurses. So as you travel, of course, there is need for you to be bilingual. Nobody could get or be a nurse in United States without passing the IELTS or TOEFL. So that only means you have to be bilingual. You have to be speaking in English and speaking in Tagalog. So same as well with the Japanese and German language. Before you could go or serve in Japan as nurse, you need to pass their Japanese or German language in Germany before they can take you in as their nurses. So as well in Arabic, I know how to speak Libyan Arabic, English, and Filipino. So they say that if you are speaking in 5 languages, then that means you are genius. If you know 5 languages. So I still need 2 more languages to be considered as genius. So try it, probably you would know. And then Cleopatra knows 9 languages. That means she is more than a genius, knowing 9 languages. And then allegedly she also know more than up to 19 languages. So can you just imagine? She traveled around the world using 19 languages. So just that is just a small trivia, just telling everyone that this trend help increase the best care possible. So if you are now traveling and bilingual, that means there will be job opportunity will be plentiful. So what does that mean? So there is a report from American Nurses Association wherein the registered nurse job will be available throughout 2022 than any other profession in the United States. Okay, so for those of you who are planning to go to States, make it quick in your BSN education. Okay, and then according to U.S. Bureau of Labor and Statistics, there is an increase of 9% employment from across the country throughout 2030. And there will be as much as 200,000 job openings for nurses per annum. So again, this trend help increase the best care possible. And if there is a job opportunity, more job opportunity, there will be a nursing shortage and there will be more male nurses continue to rise. So as we know that the nursing profession is from the traditional way, it is actually only for female or it's a feminine course. But this time it's different wherein there are already males that are enrolling in this profession. So the reason for the shortage of the nurses is number one, the nurses are reaching retirement age wherein roughly one-third of the current nursing population will retire in the next 10 years to 15 years. And another thing that contributes to the shortage of nurses is an aging population that requires more care. At least the baby boomers will retire at the age of in 2029, wherein some of them are retiring at the age of 65. But you know, in other countries, there is no age discrimination. If you still want to continue to work with your company, you could do so even you are already retired. And the retirement age is, yes, I said it already, it's 65. But in the Philippines, the retirement age is 60 years old. And we are somewhat discriminating that once you reach 60 years old, you cannot work anymore. So that is the trend in the Philippines. And another thing, this is the most crucial of all because not only the baby boomers but also the millennials could experience burnout and resign. So nurses experience a high turnover rate and the stress in COVID-19 could exacerbate the problem. So if you are a nurse and you already have these symptoms or you are already feeling burnout in what you are doing in the hospital or in your job, you have to consult your superiors to give you a holiday in order to recharge from your job so that it will rejuvenate your working powers. So since none of these reality are going away anytime soon, high demand for caregivers should be in a nursing trend in 2022. So since we have a shortage of nurses, there will be an increase of caregivers demand to help the nurses shortage, but not to replace the nurses. And so as well, if there are shortage in nurses, there is a healthcare organizers will continue to focus on hiring and recruiting male nurses. And so as well, if there are shortage of nurses, there will also be a shortage of physicians, of doctors. And so nurses will expand their expertise to took up DNP. What is this DNP? I already said it before. Doctors in nursing practice, wherein the nurses are helping some of the work responsibility of the doctors for them. Like for instance, when I was in Canada, I brought my patient to the clinic, and surprisingly, that the clinic doesn't have a doctor, but instead they have nurses that are, we call prescriptionists. They are there to do physical assessment and assess the patient on which medication to give, and then after assessing, they will give you the medicine, and they were called as prescriptionists. So they are aiding the other works of the doctors, wherein but still they cannot perform the other medical doctors are doing. So again, this trend help increase the best care possible. And second to the last but not the least, this is the most awaited, and this is my favorite of all the trends in this 2022, wherein the salary and benefit will need to increase, and there will be more money for nurses. According to the Bureau of Labor and Statistics, nursing median salary of $75,000 in year 2020, and it will increase to $80,000 and more in year 2020 and years to come. Because of the global pandemic and shortage, nurses, listen to this, nurses wherein the employers learn to value the nurses. Can you just imagine? We need to have this pandemic before you could value the work of the nurses. So we have to satisfy the nurses with regards to their salary, so that they will not be keep on job hopping. So from coming from one hospital to another, because this hospital is giving much more salary. So to prevent it, the hospital and administration right now are making the nurses well compensated, and they increases their salary, and so as well with the other benefits of the nurses. So it will continue to grow, so employers will retain their employees and attach potential candidates of loyalty in their hospital. So again, this trend help increase the best care possible. So last but not the least, of course, I said these all are interrelated with each other, wherein we have to support the nurses' mental health because it will continue to rise. That's why we have this seminar wherein one of our intelligent and beautiful Dr. Lucila Espinosa will discuss to us the caring for carers afternoon. We have to care for the carers because the nurses work long shift and often go without breaking an hours, and sometimes at the end they don't make any break because it's sometimes they are lazy to remove and wear again their PPE suit. And the truth is, many nurses love quick pace in their work, but that pace, emotionally draining tasks of caring for ill patient doesn't always lend to itself to tithing mental health. So again, this trend help increase the best care possible. So to summarize, I hope you are getting something from this seminar. So to summarize is the nurses, as the nation's largest group of healthcare practitioners, have a key role to play in sharing or shaping the future healthcare and the nation's health. So the nurses should also participate in the development of better healthcare for all the parts of the society, and embrace the use of nursing Informatics gradually. And there will also be a lot of opportunities considering to be enrolled in a world-class online nursing degree education and make healthcare accessible to all people and make the service more readily available for all the patient, for the patient convenience. And then lastly, to support the self-management of healthcare to both the patient and the healthcare providers. So again, these new trends help increase the best care possible. So these are my reference. That's all for this afternoon. So since we are a bilingual nurses, arigato for the Japanese, shukran jasilan for the Arabic, merci beaucoup for Tunisians, gracias for Spaniards, salamat for Filipino, thank you in English, and I think, correct me if I'm wrong, moshi moshi for the Chinese. So that's all for this afternoon. I now give the floor to the next speaker. Thank you.
Thank you, Ma'am Jenny Lynn. The nursing profession truly is an innovative vocation with a lot of exciting opportunities in store for us.
Absolutely, Ms. Shireen. Those circumstances will make us become more globally competitive and in demand. Moving on to another remarkable speaker, allow my co-host to let us know more about her. Take it away, Ma'am Shireen.
Good afternoon, everyone. It is with great honor for me to introduce to you our second speaker for this webinar. She graduated her Bachelor of Science in Nursing in Concordia College. She completed her Master in Hospital Administration at the Ateneo Graduate School and her Master in Nursing Administration at the University of the Philippines, where she also received her Certificate of Health Emergency Management, a postgraduate course. A licensed embalmer, our distinguished speaker also holds a degree in aesthetic embalming. Furthermore, she completed her Master of Arts in Nursing, major in Mental Health and Psychiatric Nursing at the Arellano University, and her Doctor in Nursing Management degree at the Trinity University of Asia. Our speaker has almost 5 decades of working experience in different areas of nursing, from being a staff nurse, instructor, lecturer and reviewer, nursing director, and now a nurse consultant. She also has authored several nursing books and manuals. She also has a number of awards under her belt, including the prestigious Annie Sand Recognition Award, the highest accolade given by the National League of Philippine Government Nurses Incorporated. Today, she will be sharing with us her insights concerning the care of, not of patients this time, but those taking care of them, the carers. So now, please join me in welcoming the remarkable Dr. Lucila Ortiz Espinosa.
Hello, a blessed day to all of you. It's a pleasure and a privilege to be invited as one of your speakers in this very important event, very momentous event in your lives as students. Mind you, getting into this aspect is really a gratifying one, in as much as it is really my advocacy to foster more awareness about mental health and psychiatric nursing. And as I am now into this process, I would like to congratulate the organizer, the advisor, Pauline, and also Sha, and well, of course, Hilda, for giving me this destined opportunity. I would like also to express my sincerest gratification and also appreciation to all these participants for having this seminar. And at this point in time, as I try to introspect, feelings of nostalgia set in. You know, this event gave me the opportunity to feel once more my experience as a new and aspiring nurse of the National Center for Mental Health, where I served the solid 44 years of my professional life. Right after graduation, without further any consideration to other fields of nursing, I went into mental health and psychiatric nursing. You know, it was very painful in the bottom of my heart. My heart usually bled. What was then the reason? You know, care for mental patients is far from ideal. A fresh graduate from a college of nursing, I found myself to be very idealistic. My focus was only on my career. I don't have any boyfriend. Kumbaga, virgin pa ako. All my efforts are geared towards my profession. You know, I found patients for admission. They were chained like this, nakaposas. And I can really forget when one of our clients was admitted, the reason behind her admission was she turned her 6-month-old infant into an adobo. Now, they usually seek for help because of these auditory hallucinations, delusions, where they created this parasite, so on and so forth. So I promised to myself that through my small effort, I can perhaps educate people, I can perhaps raise awareness among the Filipino people that those individuals with mental illnesses should be treated with compassion. Now, I am really trying hard to have this stigma be erased, but it was very hard on my part. But nowadays, I can say that I am quite victorious because people now really value the importance of mental health. We have to remember, based on the definition of the World Health Organization, what is health? Health is a state of physical, emotional, psychological, social, and mental well-being. So it is included in the definition, the word mental. So we have to bear in mind that there will be no health without mental health. So with these thoughts in mind, I would like to present my rationale for clarity purposes and for simplicity. I would like to bring the background and key points of my paper. Background and also the key points of my presentation. In the United States, year 2020, there was a report that 4 in 10 caregivers consider their caregiving situation to be highly stressful, or it is 36%. Now, whereas in the United Kingdom, it was reported that British can be carers at some point in their lives. Another dynamics or reason behind my presentation is It is a fact that every day carers can become lonely, isolated, and experience stress and depression. With the pandemic, the landscape has changed dramatically. Or in other words, the emotional condition or the mental condition of carers really affected the pandemic. So can you just imagine every day to be surrounded by people having sufferings, physical, emotional, psychological sufferings, and with the restrictions and also with the pains and suffering of people around. So this greatly affected the emotional condition of carers. Now, we have to take into account that sudden disruption in the relationships. We are now missing our loved ones, loss of jobs and incomes. My husband told me walang laman sa mga groceries. There are no people inside the groceries. He even said, I think even supermarkets will be closing because of the financial reason, the loss of jobs and incomes. Another one is the sudden isolation from the outdoors. You know, when I went out of our house last December 28th, I missed all those places that we have gone through. And I really experienced pain upon seeing those old places that we enjoyed. They are now closed because of this pandemic. There are isolation with loved ones because of connection. It's good that we have now the technology that we can have the video call, can have the phone call, but having this face-to-face or the physical closeness with relatives is really very different. Chelsea, mahirap yung ano. Okay. So I'm sorry, I'm having a difficulty with my... Okay, another one. Jacob warns that isolated caregivers are prone to burnout and more risk of depression. Now, I'll be differentiating burnout from compassion fatigue. And really, if we won't be addressing burnout, if we will not be addressing compassion fatigue among our carers, we may have some depression. We are aware that to be depressed is just like having flu. It is just like having pneumonia. But the problem is that all depressed patients are potentially suicidal. That is why they are in need of a strong support system. But how can you give them this strong support system if they are separated from those people whom they love so dearly? We have to take into account that all the stress reduction techniques, all those stress relief activities will be futile if we won't be indulging into self-care. It is a must among us carers. Self-care is vital for building resilience, for building our ability to bounce back, our ability to be flexible towards those stressors that we cannot eliminate. Okay, another rationale or another dynamics or reason behind this paper is that carers, managers, home care owners should employ positive practice environment. Managers, supervisors, chief nursing officers, you have to employ the different aspects of positive practice environment. Okay, according to the American Nurses Association 2016, positive practice environment is providing healthcare personnel safe and satisfying environment. Now, the reason for the healthcare and nursing crisis are varied and complex, but evidence studies underlines that unhealthy work environments are key among them. Okay, so let me now present the outcome objectives. Now, the outcome objectives of my paper is actually placed into different classifications. First is that of knowledge-driven. Another one is competency-based. And the last is value-based. Now, I hope the participants will be able to discuss stress, the anatomy of stress, where is it coming from, what are the immediate, delayed, and as well as chronic effects of stress. Hopefully, you can identify the possible outcomes of a stressful caregiving situation. We are aware that every day is a stressful one. We cannot eliminate stress, but we can have our stress be reduced into a more comfortable level. Another one is to discuss essential caregiver coping strategies. Those adaptive coping, those techniques that can be utilized not only as caregivers, but you can use this in your own personal level, in your own family situation. Kumbaga, ito ay pang-sports, pang-pamilya pa, it can be for love life. Okay, next is in the area of competency-based. Hopefully, you can apply techniques on how to manage stress. And another area on competency-based is to utilize strategies on how to attain optimum mental health. Now, in the area of value-based, I hope that you will be able to appreciate the importance of self-care. You know, as I've said, all those stress relief, all those techniques will be futile if you will not give importance to self-care. And the last is, I hope that you can value the positive practice environment in the workplace. By the way, my presentation will be based on as a clinician, on my 44 years of service at the National Center for Mental Health, and also as an academician. I've been a part-time reviewer, part-time instructor from various colleges of nursing and different review centers with a special focus on mental health and psychiatric nursing. And now, even though after my retirement, I will always go into advocacy to have the status of mental health in our country in its proper perspective. Right after my retirement, I was hired by the Department of Health as a consultant for drug prevention and rehabilitation. Now I am with the DSWD. Okay, so let me now move on into the proper area of my paper. I'm sorry, medyo. Okay, so first and foremost, allow me to give the definition of stress. What is stress? Now, let me point out that stress is a part of being alive. It's a person-environment interaction. We will not have stress when we are 6 feet under the ground or when we are psychologically dead, just like the mental patients. Right now, I am putting a stress on my throat. But if, say, for example, I learned from the evaluation that there were some learnings that took place, I know to educate people will make people understand the importance of mental health. I would like, it's really my ambition to create advocates of mental health and mental health care. Because if you will be advocates, you will be inspiring people on how to inspire other people to value the importance of mental health. So, stress is actually a broad class of experience in which a demanding situation taxes a person's resources or coping capabilities, causing a negative effect. Actually, to be stressed is not always negative. There are two types of stress. These are U is stress, EU stress. It's normal, and U stress will have a positive force. This webinar gave some degree of U stress. In as much as I have various commitments, I have to, being the Chief Nursing Officer of our family-owned caregiving, St. Lucy's Caregiving Services, is really taxing on my role as a nurse, not only as a nurse, but also as psychoeducator. And at times, I have to be a mother surrogate to our patients and other roles of a mental health nurse. Another form of stress is distress, difficult. Distress is something abnormal. It will always have a negative result. Actually, you can go back to yourself and determine if you are already into the state of distress. There are two universal symptoms of distress, and these are sadness. Without any apparent cause at all, you go into being sad, nalulungkot. I know that this is really happening among our nurses in Saudi. Although I enjoyed my 1 week of stay in Riyadh when I was invited in Prince Sultan Military Medical Center, but I can see the situation that it is very different from the situation that are experienced by our nurses in America, in UK, and also in Australia. And I really admire your heroic deeds. Hindi natin yan maisasang tabi. For you to be sad is normal. But if, say, for example, your sadness is coupled by emptiness and also not being only sad, empty, and irritable for more than 2 weeks, take note, this can be a symptom, or perhaps we have to be alarmed that you can be perhaps depressed. And aside from sadness is that if, say, for example, you are easy to anger, madali kayong magalit. Anger is a natural feeling. Anger is normal in any form of relationship. But if you are angry without really the proportion to be angry, and if you did not handle anger appropriately, it will be, the effect is devastating. Okay, next, my dear, it's a person-environment interaction. Now, as I was delivering this paper, I heard noises from our neighbor because they are having a renovation of their house. So it really created some stress. Another one, it is an adaptive response. Kasama yan sa buhay. And it's a part of human existence. Now, take note, stress can be healthy. It can be also unhealthy. So it depends upon how we handle stress. Okay, it is an incredibly complex and immediate whole body response to a perceived or real threat. The threat could not be real. It could be only a perceived one. And a good example, my dear, because of the pandemic, there were really perceived threats into our physical, emotional, and our total well-being. Okay, the stress mechanism or the emergency response process is designed to get our body defend itself by fight, flight, or freeze. I would like also to share with you what are some of the immediate effects of stress. I know sila Pauline, sila Hilda, sila Shia, you had some stress. Mind you, you may have some halted digestion, hindi natutunawan. There could be an increase in your vital signs, an increase in oxygenation, an increase, nagiging sharp ang memory mo. There could be also an increase in your vital signs. And take note, what could be the delayed response? You will have some problems with the presence of the pandemic. Your immune system can be compromised. And some may find out, bakit kaya ako lumulusog, baby? And others will be telling, tumataba sa problema. Actually, it is the failure of our body metabolism to utilize properly the food that we have eaten. Those food that we have eaten should be utilized in the form of energy, pero nade-deposit siya dun sa mga parts ng body natin. That is why yung sexy body natin ay affected. But I am really telling you that the chronic response to stress may make a person to have some cardiac ailment. With those chronic reaction, there will be an increase in the norepinephrine. The norepinephrine is a negative neurotransmitter. It is harsh in our cardiac area, cardiovascular. Now, there will be also an increase in the cortisol. Cortisol is toxic to our brain cells, making us to develop eventually dementia or other dementing conditions. Now, let us consider some situations. Dati, kumakain ako, I eat dried fish, kumakain ng ginamos, bagoong, etc. But now, bakit kaya ako nagkakaroon ng allergies? Now, perhaps when you took all those high allergen foods, you are stressed. That is why cortisol may go into the release. Okay, so because of stress, we may go into fight. What is fight? You become assertive. Mabuti yon. Others may become aggressive, may become physically aggressive, you may become violent, and others may have also the freeze. Freeze. What is freeze? Dead ma, apathetic, ma at pa. Malay ko, pakialam ko. Others will go into flight. What is flight? It's a passive response. Flight, you go into withdrawal. So hindi yan ang ginagawa ng mga couples sa gabi. Ibang klaseng withdrawal yon. What do I mean by withdrawal? You may just find yourself to be isolating. You don't want to see people. But mind you, you can become pathologically withdrawn, and continuous withdrawal may complicate the situation. Okay, let me now point out what are the possible outcomes of a stressful caregiving situation. We have burnout, compassion fatigue, alcohol, drug, and other chemical abuse or dependence, anxiety-related disorders, depressive disorders, and other mental disorders, and well, of course, various physical illnesses. Now, it is impossible for me to have all these things be discussed, but I selected your burnout and also your compassion fatigue. I'll try to differentiate the differences between burnout and also that of compassion fatigue. Now, I am also alarmed that among us nurses, there are nurses who are into alcohol, nurses into drug, nurses into chemical abuse, nurses into gambling disorder. Now, nurses who are into, take note, anong nangyayari? Hoarding disorder. Bili ng bili kahit hindi kailangan, to the point that your rooms are already cluttered, to the point that your bedroom will not be serving its purpose anymore. What is the reason? Because of stress. There could be anxiety-related disorders like in the form of post-traumatic stress disorder. There could be anxiety-related disorders like having your panic disorder, social phobia, phobic disorder. Others may go into depressive disorders and other mental disorders. Nakakalungkot that nowadays the services of our psychiatrists will be very, very difficult. The scenario is that in the entire Philippines, we have only 500 psychiatrists, although there are about 700 alive psychiatrists, but the problem, some of them are already retired, some of them, they went into other fields. So can you just imagine the deficit with this number of Filipino peoples with 500? psychiatrists. That is why the World Health Organization came up with the Mental Health Global Action Program, Mental Health Gap. Now, with the Mental Health Global Action Program, actually, before I left, after my 44 years in the mental hospital, we were the ones who were sent by the Department of Health to teach Mental Health Global Action Program. Okay, the Mental Health Global Action Program is prepared to help those midwives, barangay health workers, policemen, teachers to handle people with mental illnesses. Okay, it is actually a guide, a simple guide. But the problem is because of the pandemic, even after my retirement, I was still stopped by the institution to teach those far-flung areas of the country. Lumalakad kami sa mga putikan, sa mga pilapil, to reach out those people with mental illnesses, and I can see people with mental illnesses were chained, nakaposas, nakakulong para silang mga baboy at manok. And mind you, it is really very difficult, much more during this pandemic. Okay, physical illnesses, it's good that we have doctors, clinical, those interns are internists, but the problem with psychiatrists is really worst. Okay, at this point in time, let me discuss what is caregiver burnout. Now, caregiver burnout is a state of physical, emotional, and mental exhaustion, which may be accompanied by a change in attitude from positive and caring to negative and unconcerned. Your coworkers, your superior may notice, bakit ganon? What could be the reason? She is one of our dedicated nurses. Now I find her to be apathetic, parang walang pakialam, mainit ang ulo. Okay, there are instances like if you go back to yourself, you will find yourself to be wala akong ganang mag-report ng trabaho. Wala ako, naiinis ako. Now, there were instances that I experienced this. Anong ginagawa ko? I have to file some vacation because I have to exercise self-care. Okay? So if you find yourself to be in this situation, it is a time for you to love yourself. The greatest love of them all is to love yourself. Okay? Now, what about compassion fatigue? Compassion fatigue. Compassion is our consciousness, our deliberate effort to alleviate the sufferings of others. Okay, fatigue is actually we are already exhausted in caring for our clients. Okay, those we carers who are working with the suffering suffer themselves because of the work. By the way, compassion fatigue is also known as secondary victimization. Now, according to Biaton and Murray, we absorb the traumatic illness of those we help. Tao lang. So we have the tendency to absorb. We have the tendency to ingest, to introject the sufferings of other people. Now, at this point, what could be the difference between that of burnout from that of compassion fatigue? Compassion fatigue is cumulative. It's naiipon that is beyond any particular or a specific relationship. It's temporary and limited to a particular relationship. Say, for example, you cared for your client with COVID, you cared for a young child, you cared for a young child with autistic spectrum disorder. It is destined that you will have the consciousness, the deliberate action to perhaps handle or to handle the difficulties or the distress that your client is experiencing. But there will be a tendency for you to be exhausted with your compassion. Now, what about burnout? It is usually organizational in nature. Like, for example, you've been in the emergency room most of the time. Okay, this can be brought about by the protocols. This can be brought about by the different stresses that you handle, more of the organization and not on a specific particular relationship to a client. But mind you, we carers are predisposed to have this condition. Now, compassion fatigue, my dear carers, you can, in the process of assessment, take note that there are 3 Is to be alarmed with. What are the 3 Is? Is E, means to say you have the exposure. You were exposed to that difficult situation. I found out a certain doctor presenting the attachment that he had towards his COVID client. He was crying. And mind you, there is that exposure to that highly traumatic experience. Another E, my dear, is you have the empathy. The closer you are with the client, the more you become empathetic, the more you become vulnerable to have this disorder. And E, you have the emotional state. Like, for example, you have the anxiety, you have the irritability, you have the depression, all the emotional states that can be considered when you are intentionally, deliberately, specifically attached to a specific person or a particular person. Okay, so at this point, let me now present, medyo mabagal, okay? What are the definitive signs of caregiver burnout? Caregiver burnout. The definitive signs, according to the Mayo Clinic, provides a comprehensive list and possible red flags. One is poor sleep. Now, there will be complaints, ano ba yan? I already practice sleep hygiene. Hindi pa ako makatulog. I am having a difficulty falling asleep. Being irritable, angry, or sad without any apparent reason at all. You can be easily provoked. Another one is drinking or smoking more. Okay, constantly sick. Lagi ka na lang may sipon, laging may ubo, laging may lagnat, or no time for relaxation. Okay, so how do we manage stress? There are various ways for us to manage stress. As I've told you, we cannot eliminate stress, but we can manage stress in this particular situation. First, let us manipulate the environment. I was really stressed when the Fatima, Our Lady of University, Fatima, we were before residing in front of Our Lady of Fatima, actually inside a subdivision, and we found out that there were so many houses that were built into dormitories. Can you just imagine? It was chaotic hearing those loud noises created by students of Our Lady of Fatima. So I have to manipulate the environment. What do I have to do? So I have to build a high fence. No, nakaipon ako, nagpataas ng fence to perhaps eliminate the noises created by the students. Number 2, let us monitor our stress level. Now, during one of your attendance in a mass, you found yourself to be, you cannot be kept still. You kept on checking on your watch. You've been criticizing people attending the mass, the priest. Now take note. This can be an indication that your stress level is increasing. Number 3, let us cope with stress. What are the ways for us to cope stress? There are various ways for us to do this coping with the stress. One of which is, firstly, we have to assess, identify your stress level. If your reaction is a mild one, now perhaps you can have your deep breathing. But if, say, for example, you are having a higher level of stress, you can perhaps go into gardening or other ways of eliminating or reducing your stress. Glass anak of water. Okay, letter B, analyze your stress status. What is causing you to be stressed? Let us try to introspect what went wrong, what could be the contributory factors behind this stress status. Letter C, let us go into diversionary coping. Like for example, we can have physical diversion, like going into jogging, like having some biking. You can also perhaps have some walking with your loved ones, but take note, this can be prevented because of the pandemic. Now we can go into mental diversion. Right now, I am anticipating for that TV show from GMA that is the first lady. Okay, so these are simple joys giving me the opportunity to care for myself. Okay, meditation. From time to time, you can go into meditation. You can reflect back, have some quiet moments, an opportunity for you to decompress yourself with the difficulties that you are having in the demands of your work in Saudi Arabia and in other parts of the world. Okay, let us indulge into laughter. You know, with laughter, there is that release of that positive transmitter which is known as endorphins. Endorphins is released by the hypothalamus. Endorphins will give us the feel-good feeling. Not only the feel-good feeling, if you have a pain on your neck, pain on your head, it is a natural opiate. So you don't have to take your analgesics, just go into laughter. With laughter, there is a small increase in our vital signs. There is that stimulation, and after reaching that peak, there will be a relaxation. Okay? So another way of managing our stress is through diet. That is through a holistic level. We don't only indulge into emotional, mental, or psychological. We can take it into a holistic level. One is through exercise. Exercise is a must. Exercise will be one of the stress relief that you can have. With exercise, again, there will be release of your serotonin. Serotonin is a mood elevator, a positive neurotransmitter. You can also have your diet. What should be the diet that you have to be indulged with? Now, you have to take a bowl of oatmeal. Okay, a bowl of oatmeal. What could be the reason? Because oatmeal, my dear, is the richest source of serotonin. As I've told you, it is a mood elevator. It controls the sleep and wake cycle. Now, aside from this oatmeal, you can have carbo, you can also have presence of friends. Chocolate is also a rich source of serotonin. And take note, you have to add milk. Okay, lagyan natin ng gatas ang ating oatmeal. Anong reason? Kasi milk is said to be, ayan, napuno na. Milk is said to be, my dear, creator of L-tryptophan. L-tryptophan is a precursor of your serotonin. It precedes the serotonin, an enzyme before we can have the serotonin. Okay, siya nga pala yung straight na yon. That is banana. Why banana? Banana is potassium. Banana is the one that will carry the serotonin from the food that we have eaten to our brain. Kailangan actually yung potassium, yung L-tryptophan, these are the vehicle for our serotonin. We need also 2 eggs for the protein and also for the calcium, and well, of course, we need sari-saring gulay at prutas. Sorry for my presentation of this diet. Okay, just to give some light moment, okay, alam nyo naman ang mental health nurses, we are all avid fans of Sigmund Freud. Sigmund Freud is said to be the sexiest among the psychiatrists. Okay, we have to alter lifestyle pattern. Okay, alter lifestyle pattern. As I've told you, if you have problems, you go into drinking, you go into smoking, you go into hoarding, you go into perhaps you go into shopping. Take note, we have other ways of gaining some happiness aside from the former ways of enjoying or enjoyment. Okay, through controlled breathing, you go into deep breathing. Inhale through your nose, exhale through your mouth, and you produce a whoosing sound. And when you go into controlled breathing, my dear, your posture, your spine should be straight. Lahat ng bagay, erect. Okay, pag nag-inhale, inhale, exhale, and take note. These processes will make your breathing from very shallow. It is said to be, you will become tired if your breathing is shallow. Eventually, if you indulge into this, you will have deep breathing and it is more relaxing. Okay, through relaxation. We don't have enough time, but I think relaxation can be one of the avenues for us to have our stress be lessened. Okay, so at this point in time, my dear, let me share with you essential caregiving coping strategies. What are these? Number one, take a time out. As I've told you, I found myself na very easy ako to anger or instances wherein I go into displacement. Okay, pinagbubuntunan ko si husband, our children. So I think it will be the best time for me to take a leave. As much as possible, it must be a sanctioned leave. You have to discuss your desire with your supervisor because if you will only be having some malingering, the more you will be guilty if you will find out that during your leave that there were some difficult moments that were experienced by your coworkers with your unsanctioned leave. Next one, accept yourself. Have a loving acceptance of yourself. Remember, no one is perfect. Even Mr. Perfecto is not perfect. Walang taong perfecto. Okay, we have to accept that we are a person with limitations, that we have bad points, we have those liabilities, but consider your good points. Okay, we were created by God. Well, of course, we were created with all the talents, with all those beautiful things in us. So have a loving acceptance of yourself. Number three, write it down. Isulat mo. Journaling. Among our clients, we are using this journaling. By the way, let me go into disclosure with you. I came from a chaotic family condition, unstable family situation. My father, an alcoholic, and during his moments of alcoholism, ano ginagawa niya? My mother was physically and emotionally abused. Inuumbag niya ang nanay ko. Okay, what did I do during those darkest moments of my childhood years? Sinusulat ko. I did not realize that I was already treating myself. Okay, sinusulat ko those painful events in my life. Yung iba, nakatago pa yon. Pero when I was already a professional mental health nurse, it will be wise that you will be using, my dear, your less dominant hand, because your less dominant hand is more of the emotional, more of the affective. Now, even your penmanship is the worst as long as you can release your emotions. Madaling i-release ang emotions natin kasi yung ating less dominant is more of the emotional. Yung dominant hand natin is more of the cognition. But we want our emotions, our stresses be reduced. Please write it down. Okay, from that technique, I developed what I term as salty. Send a letter to yourself, or you go into salt and pepper. Send a letter to anyone. Okay, well, of course, father figure during those moments, it was really very, very strict. So I have just to write a letter on my father, write a letter towards myself, and at this point in time, napatawad ko na ang sarili ko. Ano ang reason why I said that napatawad ko na ang sarili ko? I'll be honest with you, there were moments together with my mother, we wanted our kaming dalawa, gusto naming patayin si tatay. I've been into a maladaptive coping, like going to stowaway, naglalayas ako. There were moments na natutulog ako, I have to sleep inside a coffin. What was then the reason? May punerarya kami, so I can no longer tolerate those painful situations. That was the reason why I have to escape. Nakakatulog ako sa aming coffin, sa aming ataol, kasi meron kaming funeral parlor. Very queer, very absurd. Pero take note, those experiences were enriching experiences for
Recording in
quality
progress.
time. Simple choice, simple moments. Kahit isang platitong peanut with soft drinks, but the quality time, my dear, is really gratifying. Next is focusing on the positive. There are people who are negative but focus on their positive. Maganda naman siyang makisama, mabait naman siya, so focus on those negative. Magaling siyang makitungo sa client, those negative should be cultivated. Okay, make a personal declaration. What was then my personal declaration for
Recording in
people who are
progress.
stressed? And take note, who will be the one to deliver self-care? Self-care, it is by you, not in the narcissistic way, not indulging into self-love. Okay, so I have to make my paper short, my dear. Now, perhaps it's important that I deliver how to attain optimum mental health. How to deliver optimum mental health, my dear, you can use this hashtag new start. Hashtag new start. First, nutrition, no to drugs and alcohol. E, exercise, go into empathy. Now, W, water. The more we are irritable, the more we are dehydrated, the more we become irritable. Watch out for your weight, and weight, have tolerance. S stands for self-awareness, support from loved ones, practice self-care, and stress reduction techniques. Letter T, tolerance, time management, and talk. Indulge into laway therapy. A, air, act of kindness. Be altruistic. R is rest and relaxation. And as caregiver, as home care managers, my dear, we have to practice positive practice environment. Now, the World Health Organization said that positive practice environment is an environment that will promote the physical, mental, and social well-being of the health workforce. Okay, what are these? Innovative policy framework, focus on recruitment and retention, continuing education and upgrading, adequate employee compensation, sufficient equipment and supplies, and well, of course, a safe working condition. It's quite difficult to have this be cultivated because our home care caters to those people with mental illnesses, those elderly clients with dementia, and other people who are in need of mental health care. Recognition awards. Okay. So positive practice environment are settings that support excellence and decent work. Okay, it strives health, safety, and personal well-being of staff, quality care, motivation, productivity, performance of individuals and organization. A positive work and outcome, my dear, will be always towards an improvement in patient care. The outcome will be on improved patient care or a positive patient outcome. Okay, so standards for establishing and sustaining health work environment, allow me to use the acronym of METASA, MICAP, a meaningful recognition, simple pat on the shoulder. It is not that expensive. Now, giving opportunities for them to celebrate Christmas or celebrate important events in their lives with their loved ones, or offering them some birthday parties. Effective decision making. Remember, decision making is important among care managers. Next, through collaboration and a genuine collaboration. Next is appropriate staffing. Tama lang. Skilled communication. Use your therapeutic communication technique. And lastly, authentic leadership. A true leader. Okay? Next, my dear, is actually that are the benefits of positive practice environment, my dear. The benefits is siyempre better teamwork, quality patient care, okay, health, staff morale, increased productivity, job satisfaction, lower turnover rate. The effect among clients, low mortality, patient falls, infections, etc. Okay, so at this point in time, I would like to express my sincerest gratification. Thanks to all of you. This presentation is lovingly dedicated to all of you health workers, to all the carers who are inherently altruistic, compassionate, brilliant, and to those who have cared for, those who are currently working, caring for others, and for those who will be caring for them. They will forever ignite in me the fire in my passion for loving and caring. Maraming salamat po. Mabuhay kayong lahat. Thank you so much and God bless all of you. Okay. Thank you.
Wow. Thank you so much, Dr. Lucila Ortiz Espinosa. That was wonderful. And we thank you so much for imparting knowledge to our colleagues watching us right now on how we can take care of ourselves as nurses. And indeed, nurses are human beings too, and we needed to be taken care of as well. Right, Ma'am Shireen?
Very inspiring indeed, Miss Anne. Moreover, Dr. Espinosa also gave emphasis on self-care and how we can attain the benefits of positive practice environment, which is very vital for us carers to first know how we can take care of ourselves so we can also give optimal care and the best practices towards our patients.
Okay, all right. I believe at this point we can now proceed in the question and answer portion of this webinar. But before that, we would like to thank everyone who joined us in this webinar.
Yes, ma'am. To start off, we have collected some of the questions from some of our registrants, which our respected speakers will be answering now.
And also for those who have questions now, you can send your questions in the Q&A section and we will try to address them to our guest speakers. Please include to whom the questions are addressed. All right. So for our first question, it will be coming from Miss K, a registered nurse from KSA. And this question is addressed to Ma'am Jeneline.
Hi everyone, I'm Kay Encarnacion, a quality and patient safety nurse here in Shakra Hospital, Riyadh, Saudi Arabia. First of all, thank you Ma'am Jeneline for sharing your knowledge and motivating us through all the information you have discussed. With regards to nursing education, we all know that today the education system is facing a very challenging situation. With the emergence of the digital education platform, a transition from the traditional face-to-face classes wherein there is actual demonstration and return demonstration, these things, I would like to know, based on your expertise as an educator at this point in time, how do you see this new cyber education system would affect the performance of our future nurses, or does it have any effect at all? Thank you, ma'am.
The first question is coming from Miss K Encarnacion. So, Miss K, your question is actually a mind-blowing question because you're right that the pandemic has brought many challenges in the educational system right now. And my answer to your question is a yes. The cyber education has effect in the performance of the nurses in the near future because but in a positive way. In a positive way because we are already teaching the students this time through cyber education on how to be creative and to become a researcher on their own, and they are also taught to be self-motivated independent, resourceful, and responsible in their own learning in their own convenient time. But actually, the CHED or the Commission on Higher Education is helping other universities, giving us guidelines in order for us to meet the needs of our students effectively. So we came out with the alternative learning activities wherein this enhance the education of our students, wherein we evaluate the learning activities so that if it is the result is positive, we continue and think for further positive learning activities in connection to their learnings. So I hope I answered your question, Ms. Encarnacion.
Thank you, Ma'am Jeneline. Our next question is coming from Ma'am Rachel Ann, also from Saudi Arabia, and is also addressed to Ma'am Jeneline.
Hello, good morning. My name is Rachel. I'm an ER nurse for 13 years now and currently working in Saudi Arabia. My question is for Jeneline Abala regarding the latest trends for nursing practice. Given for our new nurses having online class, my question is how would it impact our the quality of nursing care, and would it directly affect the nursing care and patient safety? That's all.
This is a good question, Ms. Rachel Ann, wherein it is somewhat related to the first question about also asking about the future nurses. The virtual education actually has a effect to the quality of nursing care in the future. There is a study, and they have interviewed the pandemic student, wherein they told us that they are not confident to work in the hospital because of their experience in the hospital during their college time is very little. So they are not confident. However, the one responsible for this after graduation is actually the employer, because the employer is the one who's going to have control over them and then will be taking charge of their experiences. And then because the employers are the one, or the training has, or the training are the one responsible for their experiences. So as we know, before you enter and become a nurse to hospital, you will undergo a on a job training. So if you pass, then good. Like for instance, our graduate worked as a nursing aide before they become a staff nurse. So being a nursing aide while they are waiting for the result of the board exam enhance their knowledge and confidence in some of the procedures in the hospital. So after passing the board exam, they report that they were being accelerated as a staff nurse in their own hospital where they are working. So just that, I hope I answered your question as well, Miss Rochelle Ann.
Okay. Thank you so much, Ma'am Rachel, for your question. And thank you so much, Ma'am Janeline, for answering that. And now this question is for Dr. Espinosa from Ma'am Sol.
Hi, I'm Zal from Asian Hospital and Medical Center. My question for you is, with a very popular nurse running for a seat in the Senate and an influencer physician running as vice president, where do you see the healthcare and the nursing profession in the Philippines 5 years from now? Thank you.
Thank you so much for your question. Actually, I am very positive with those political activities of nurses. One is running for a position in the Senate, and I'm only lonely in as much as our ang nurse party list was not elected last election. I am optimistic that they can represent well the nurses if they will be seated in the Senate. But actually, for your information, we have an undersecretary, Roger Tong-an, a nurse by profession, occupies a good position in the Department of Health. Actually, he made several jobs, like he was one of the responsible people in this salary increase of government nurses and other fringe benefits among us nurses. But as I've told you, it will entail various social and political activities before we can really attain success in those areas of political endeavor. Did I answer your question, my dear? Hopefully, these people can assist us. Actually, I am optimistic that this politician will give more attention on the plight of our nurses. One of our senators who is vying for a higher position as a part of his election platform is to increase the salaries of Filipino nurses into 50,000 plus additional fringe benefits, etc. So I hope that these promises will not be a broken promise. Thank you so much.
Thank you, Doctora. Very well said. We have another question for you, Doctora Espinosa, this time from Ma'am Rona, all the way from the Kingdom of Saudi Arabia.
Good afternoon, Dr. Espinosa and everyone present in this webinar. I am Rona Vasquez, Infection Control Practitioner here in Chakra General Hospital, Riyadh, Saudi Arabia. Thank you, Doctora, for your wonderful insights on caring for the carers. I would like to ask, because I feel like this is not only a pandemic, but infodemic as well. How do I stay informed while keeping my anxiety from skyrocketing when everywhere I look, especially social media, COVID-19 is there? Thank you.
Thank you very much for your very relevant, can you open my camera, my dear? For your very relevant question. Actually, anxiety is a normal feeling. It's a normal phenomenon. As long as we can handle our stress into the mild level of anxiety, there is no cause for us to be alarmed. With no anxiety at all, it is a state which we call ataraxia. Ataraxia is experienced by people who are into alcohol. Ataraxia can be found among people with an antisocial type of personality disorder. Now, we cannot help but we have to listen to those things that will give us an information so that we can really handle, because those scenarios, those informations will be very important, very relevant in our pursuit as a healthcare provider. However, if your anxiety will increase, now with the moderate level of anxiety, it's okay. It can be therapeutic with supervision. But the problem, by the way, anxiety, the internal state that stress produces is anxiety. Now, anxiety is more of the subjective level. But if the problem, if our anxiety escalates into the severe level, what will happen? To go into the severe level of anxiety, we may have mental block, we cannot decide, we cannot function well. And the problem, if we go into the panic level of anxiety, we go into a wild, desperate behavior. How do we handle? There are various ways of handling our anxiety. It is important that we have to have a very strong support system. But finding very strong support system nowadays is quite difficult. Now, the use of telephone, the use of video call is actually not enough. We would like really to hold real people, hold the hands of our friends, but this is impossible, very hard to be done. Okay, as I've told you, the techniques that I have shared, essential coping strategies will be helpful. You can also have your, what I told you, the journaling. You can go into this stress relieving activities. And I would like to assure all of you that to be anxious is a normal reaction of a normal person in an abnormal situation. Now, the pandemic is an abnormal situation. Now, as long as we have that family support, as long as you will be open, accepting of your difficulties, I don't see any reason for you not to handle those anxieties. But just in case your anxiety will still be there is a need for us to go into a psychiatrist. Never postpone, because anxiety, you may have anxiety, but the root cause for you to have anxiety is that of depression. So don't just indulge into taking your anxiolytics or your what we call your anti-anxiety drugs, because you are only treating the symptoms, but you don't treat the root cause. And mind you, a companion of anxiety is depression. An anxious client eventually becomes depressed because of the incapacitating effect of anxiety. So I think that was a very good question. It will be a good opener for us. Don't just take it for granted na kinakabahan, may daga sa dibdib. Don't just take for granted na ako ay nanglalamig whenever I will be stepping inside the hospital. There can be a greater problem. There can be a greater difficulty. So take note, if there is an early detection, there will be an early treatment, and early treatment means to say early recovery. Thank you so much.
Thank you so much, Dr. Espinosa, for answering that question. And now we have another question here for Ma'am Jeneline from our comment section. And our commenter is asking, where do you see telehealth or teleconsultation 5 years from now, given the current curriculum we have for nurses?
Actually, I love this question, wherein she is asking, where are we 5 years from now? We are actually, this is already our new normal. This is also our future. So we cannot stop the technology, and so as well with the science. That's why our science and technology are continue to rise. And if you still remember that I show you a 2-minute video wherein you're having a consultation station cubicle, wherein that only takes vital sign, wherein there is a reported wherein in the near future there will be a cubicle as same as that, wherein you're going to just sit there and they will see all your laboratory workout without you pricking and without taking any blood sample from you. So this only shows that the advancements in science and technology is inevitable. And there will be more technology rises, and then the telehealth and telenursing, it will be tripled in percentage by the year 2023, who is going to embrace this technology. It's just an advice that everyone should be literate technologically, and then teach yourself on how to be technologically inclined. So that's all. Thank you, and I hope you learned from our lecture today.
Thank you, Ma'am Jeneline, for answering that question. Moving on, our next question is for Dr. Espinosa, and this one is from Ma'am Sharimar.
Good morning, everyone. My name is Sharimar, and I am currently working here in Saudi Arabia with 10 years of experience here in emergency room. My question would go to Dr. Espinosa about the topic of care for carers. What are the ways that you may suggest to regulate the healthcare system to favor those nurses who are undercompensated there in the Philippines? Thank you.
Thank you so much for your very relevant and heroic question. I would like to emphasize, based on ANSAP and other nursing organizations' studies, researches that were conducted by master's students, they found out that the reason for people to stay in a certain workforce, it is not monetary, is not the priority. They found out that love, belongingness, a member of the teamwork, the recognition, those educational, and also some degree of autonomy were the number one concern in the area of retention. So remember, my dear, money will not always give reason to sanity. However, the Filipino United Nurses and also the Philippine Nurses Association, they are lobbying for the increase in the salary of Filipino nurses. There were various politicians, there were various senators. As a part of the election platform, they are now working on the increased basic salary for us Filipino nurses is 50,000 plus. But as said, this can be broken promises. Now, as long as we are happy, we are enjoying a positive practice environment, I don't think that we will always clamor for monetary. I am a good example. I had already my US visa, my USS number, but I have to give up my American dream. I don't have any regret because I am now living a satisfying life situation with my family. I don't have any regret kasi if I am already in America, perhaps I will not be given the chance to share with you these God-given talents. I will not be given this chance to touch people's lives. Pauline, to meet you, good people, to meet all these heroes, unsung heroes. So I am truly gratified if I did not leave the country and I am with the country, ang aking pinakakamahal na Pilipinas.
Very well said, Doctora. Thank you. This next question is from our comment section, and this is for Ma'am Jenny Lim. Her question is, community health nursing was not mentioned as much as a trend in nursing for this year, 2022. With the pandemic that we are suffering from, how do you think school curriculums can emphasize more in community health nursing?
I think Shireen is having a big heart to the community of nursing, so as well the Faculty of Nursing Pedagogy. Actually, you are asking about the telehealth in community health nursing that I wasn't able to mention. But the community health nursing are the one who enhance first and embrace the telehealth first of all. Remember that during the pandemic time, this is the only communication that we have in our community. So I know that everyone relate to what I'm saying. Wherein the health center are the one texting you and informing you what is the schedule for the immunization and what else are the other services of our health center? It is actually a joint forces, and the city government, the health center, and the barangay centers are the one coordinating with each other with regards to the health care services. And we are actually reaching the farthest community and individual through the use of telehealth, wherein in some places the load for the telephone conversation are being shouldered by the city government depending on their budget. And the health center are 24 hours open to cater health services to our patient, especially for the pregnant women. And they will and then they are always at in aid, by the use of telephone. And the nurses are the one creating a uh, link for the community for the health teaching. And the PWU is actually participating in the community health nursing, and so as well all our students. Like for instance, in our PhD class, we go to Pampanga. We meet the ATAS. Because we cannot reach them through telehealth, but we are already teaching them on how to use it, because that will be the means of our communication with them. Uh, this will be this will materialize as long as the community has their own cell phone. So just that.
Thank you, Ma'am Jeneline, for answering that question. This next question is again for you, ma'am. And the question is, do you think our universities here in the Philippines can easily adapt and be globally competitive in providing ABSN programs?
So our nurses are trained as well to be flexible, innovative, and we are also taught to do a critical thinking, and then to enhance intelligence, to be passionate and have passion in what we are doing, and so as well to be a hard worker. And aside from that, we are also teaching our students to have a beauty and a heart. Okay. So what I'm saying here is that this qualification alone and qualities alone makes us globally competitive. And I want to share with you that the Asian Hospital is the first hospital who opens a virtual simulation program, because they are thinking that they think quickly, and they are futuristic, and they are visionary. They already saw that the future nursing will be like this. And so the PWU has the same vision and also futuristic, and PWU is the first who patronage this virtual simulation education program. And by the way, Asian Hospital is a joint commission international, wherein they are accredited with a much more higher nursing care to our client. So just that about the global competitiveness, yes, we are globally competitive. And if you are also given a task, okay, and you do not know what is the task, just grab the opportunity and then learn the process later on.
Thank you so much, Ma'am Janeline, for answering that question. And now for our next question, this is for Dr. Espinosa, and the question is from Ma'am Edna, a nurse from KSA.
Hi, good day, Dr. Espinosa. I'm Edna Razonbianan, nurse here in KSA. I would just like to ask Are you familiar with any bill being reviewed in the Congress that aims to further promote the welfare of nurses? Thank you so much for lending us your time to answer this question, and more power.
I'm sorry, I don't have any knowledge about any bill that will elevate the standards of our nursing profession. And actually, there is that clamor for the Filipino Nurses United movement to find a seat.
You accidentally press your mute button earlier.
Okay, so I am sorry. I cannot recall of any bill that will support the endeavor of nurses. Actually, the Filipino United Nurses, they signified their intention to run for a party list in Congress, but unfortunately, they did not meet the requirement before any party list can be considered for a seat in the Congress. But with the PNA, I cannot recall, or based on my friends from the Philippine Nurses Association, I think there is no movement or any bill into that effect. Thank you so much.
Thank you so much for answering that question, Dr. Espinosa. Hopefully, there will be a bill that will protect us further nurses. And now we have another question, and this will be for you again, Doctora. And this one is from Mr. Abdulaziz, a nurse from Riyadh, KSA.
Abdulaziz, a nurse from KSA.
Thank you, sir.
I would like to ask regarding positive practice environment. Do you think that is fairly implemented amongst hospitals here and in the Philippines? If you find it poorly implemented, what can you suggest to improve its implementation? Thank you so much for sharing your knowledge and advice. Thank you.
For your interest on positive practice environment. Actually, there are some well-known medical centers like the Philippine Heart Center, St. Luke's Medical Center, knowing the leadership of my friend Nora Collantes, the leadership of Dr. Linda Buhat. They are actually into the practice of positive practice environment. But the implementation of this was not carried because of the pandemic. But in some small institutions, they've been starting out with this positive practice environment. Now with my caregiving home care facility, I've been implementing some aspects of positive practice environment that is making the facility to be safe and satisfying. Because of the pandemic, there were some limitations. What were the limitations? We cannot increase the salary of our personnel because our patients' admission went down and patients cannot afford the monthly fee because their loved ones lose their job. So unfortunately, we have to suffer from the setback. But we have cultivated communicating with them telling them the problem. We have to present the bills of patients, unpaid bills of patients. And we found out that a meaningful recognition, at times it will not entail money. As I've told you, it can be a simple pat on the shoulder. It could be perhaps asking them about the status of their families, because in our facility, we don't allow them to go home during those more than a year wherein it was really very difficult to get out of the facility. They've been with us all through thick and thin. And well, of course, with my experience as a mental health nurse, I have to cultivate my therapeutic communication techniques, establishing a trusting relationship with the coworkers. And since our psychiatrist had COVID, he was not able to report for his work in the center for 3 months. I have to devise some ways, like I devised an initial nursing assessment wherein I can assess a mental patient and only make referral through the use of the telephone. And mind you, we were smooth sailing. We were very flexible, because when you cook food with them, you cannot have the ideal menu, the ideal ingredients. So we have to communicate with our clients these problems and difficulties. So perhaps proudly, I can tell you that we were into positive practice environment. Even with this, I have only 20 patients. But mind you, the facility is safe and satisfying, because I can detect if a client is about to become violent, if the client is reacting to an auditory hallucination. So proudly, thanks God, I surpassed all those trials and difficulties. Thank you so much for that very good question.
Okay. Thank you so much, Ma'am Jeneline and Dr. Espinosa. I guess that would be it for our Q&A. Thank you for participating and asking relevant questions to our dear guest speakers. We hope our speakers, through this webinar and through your questions, have given us plenty of knowledge and updates on present nursing trends.
There are some more questions here left, Miss Anne, but due to time constraints, we can accommodate as much questions only.
I think it's time for a little entertainment. What do you think, Ma'am Shireen?
Certainly, Ma'am Anne. And now I think it's time to break the ice. We have prepared a short music video in honor of all nurses who have tirelessly been on their feet taking care of us, especially at this time of the COVID pandemic.
Okay, so sit back and relax as we listen to our version of I'll Be There For You.
When you wake up each morning and you feel like calling, I'll be there for you. When the road seems uncertain and you can't stop the hurting, I'll be there for you. When there's no one beside you, I'll be there to guide you, catch you each time you fall. When the stars won't shine anymore, I'll be there. When the world isn't kind and your dreams they need more time, I'll be there for you. If the rules they keep breaking and the future is fading, I'll be there for you. The rainbow will land in the palm of your hand. Don't ever let it go. When the stars we have each other. Just hold on tight. We can take to the skies and fly. I'll be there for you. I'll be there for you. The rainbow will land in the palm of your hand. Don't ever let it go. When the stars won't shine anymore, I'll be there. I'll be there. I'll be
Wow, that was inspiring and heartwarming, Ma'am Shireen. And thank you so much for sharing your voice for that music video.
Moving on with the program, let me present to you again our webinar chairperson, Ms. Pauline Ann Rodriguez, to lead the awarding of tokens to our speakers.
Thank you, Ma'am Shireen. Allow us to take this opportunity to present small tokens of gratitude to those people who have helped us make this webinar possible. To Dr. Lucila Ortiz Espinosa, please accept the Certificate of Appreciation as a speaker and for her outstanding contribution in catching up with nursing trends and issues. Caring for Carers, given this 12th of February 2022, signed by yours truly, Pauline M. Rodriguez, Webinar Chairperson, and Dr. Minerva B. De Ala, Dean, School of Nursing. Let us also give our appreciation to Ms. Jeneline Janal Abala for her exceptional lecture and outstanding contribution in nursing trends that will shape healthcare in 2022, given this 12th of February 2022, signed by yours truly, Pauline Ann Rodriguez, Webinar Chairperson, and Dr. Minerva B. De Ala, Dean, School of Nursing. Thank you to our respectable speakers for your time and most especially for the knowledge you have shared with us today. Moreover, as the team leader of this group, please spare me a few minutes to recognize the efforts of my team members. For heading the Communications Committee, the very friendly Ms. Gilda Cervera. For leading the registration and evaluation, the all-around, and my co-host, Ms. Shireen K. Encarnacion. For spearheading the media and promotions activities, the very tech and savvy Ms. Jean Vian Manay and Ms. JC Renz Makuha. For heading the Certificate and Appreciation Committee, the very sweet and generous Ma'am Maria Cristina Ria Rebolio. These certificates are presented this 12th of February 2022, signed by yours truly, Pauline Ann Rodriguez, Webinar Chairperson, and Dr. Minerva De Ala, Dean of the School of Nursing.
Thank you, Ms. Pauline. As much as we have worked for this event, me and my group mates would like to commend the leadership of the head of our team, the beautiful Ms. Pauline Ann Rodriguez, for being the overall chairperson of this webinar. Given this 12th of February 2022, signed by Dr. Mark Santos, course professor, and Dr. Minerva De Ala, Dean of the School of Nursing. Thank you, Ma'am Pauline, for your patience and hard work. We are very proud to be part of your group.
Thank you, Ma'am Shireen. I am as proud and grateful that all of you are with me on this. We would also like to give our special thanks to the ICT Department of the Philippine Women's University, Mr. Michael Ventanilla, the multimedia team, Ms. Rona Meituanyo, our heartfelt gratitude for your patience and kind assistance.
Again, our gratitude to everyone who has been part of the production of this webinar. To formally close this event, let us hear again from our webinar chairperson, Ms. Pauline Ann Rodriguez, to give her closing remarks.
First of all, I would like to thank God Almighty for the knowledge, wisdom, and talent He bestowed upon everyone here involved in this webinar, starting from our speakers, to the ICT and Multimedia Department, and of course to all of my group mates. This would have not been a success if I have not been surrounded by hardworking, patient, and talented colleagues as you are. To our honorable speakers, we highly appreciate that you have graced us with your presence. We thank you both for continuously making ways in improving and empowering the nursing profession. We wish you both all the best and more success. To the ICT Department and Multimedia Department, the support you have shown and given us is immeasurable. To my colleagues and classmates, we are all in this together, and to God be the glory always and forever. Thank you.
Thank you, Ma'am Pauline, for those inspiring remarks. To all, we hope you were able to gain additional knowledge from this webinar and be able to apply it in your designations.
And for our dear participants, the evaluation link and QR code is flashed on your screen. Kindly fill out the form, then afterwards an e-certificate will be generated to the email you provided.
In the event that you did not receive your certificate after 7 days, kindly send an email to me, Shireen K. Encarnacion at 2021T0721@pwu.edu.ph, or to Ms. Pauline Ann Rodriguez at 2021T0112@pwu.edu.ph.
We would like to encourage everyone to stay until the end of the Philippine Women University hymn, as the evaluation link will be posted again after the hymn.
So this concludes our program, Ms. Ann. Let me congratulate our colleagues for a job well done. To all participants, thank you once again. On behalf of the PWU Graduate Studies School of Nursing once again, I am Shireen K. Encarnacion.
And I am Pauline Ann Rodriguez. Till next time, stay safe and healthy. God bless everyone.